This is Dr. Jerry Hesch. I have a bachelor's, master's, and clinical doctorate degree in rehab. And the topic is sacroiliac joint pain, the relationship of the foot and ankle, the hips to function and mobility of the pelvis and sacroiliac. My client has significant rigidity in his feet. Well, his feet are the first shock absorber of the body. When I bring his feet up, passively, just relax and let me do the motion, just relax. I can only bring it up to a 90-degree angle. And the foot really should come up higher than that. Further to that, just relax. When I bring it up and then I spring it, it's a very hard feel, okay? Now I'm going to come to the tibia, the distal tibia, and I'm trying to load it and spring it, and there's no mobility there. I'm now going to evaluate motion below the ankle joint, where the heel, the calcaneus, articulates with the ankle bone, which is called the talus. So I stabilize here, and I grab the heel, and I'm trying to twist it left and right. The slightest little motion. It's incredibly rigid. And then we look at the midfoot right here, and I'm trying to induce pronation. I'm not getting any kind of give. Now the forefoot, this part up here, is pretty free in all of us, okay? But the midfoot and the rear foot, the ankle, are not functioning as shock absorbers. So when he walks sort of like a peg leg on both sides, and both ankles present the same way. Okay, now we're going to talk about the hip. Now, these motions can be restored in many, many people that have this restriction. We're now going to look at a log roll test in which I try to roll the leg, and I'm getting about 10 degrees of rotation here, and now I'm going to give it a thrust. It's now at the end range. It's not moving anymore, and I'm trying to thrust it, but it's so rigid it doesn't thrust. And he has the same tightness on the opposite side. I'm going to move my camera now. I don't have staff, so I am the cameraman until my wife retires again. So all apologies for incompetent videography. All right. Let's have you now lay on your stomach. This is a test I developed where you come on the back of the trochanter and you do an anterior spring, and it's so rigid I can't take up the slack, and then I can't do a spring. It's just so rigid. If I try and spring it and override that, there's no give there. That's present on both sides. Okay? Our hips are designed to bend backwards. When we walk, they're supposed to be able to move backwards. And the opposite of the hip, of the thigh moving back, is the pelvis moving back on the hip. And both of those motions are very limited. Now I'm going to try and lift this leg up, but I can only go a very small amount. So we want to restore that movement as well. And there is one more movement through the pelvis that is blocked. When I come under the pelvis on the left side, I can load it to a stop point, spring it, and it springs and it recoils. I see the movement all the way up his body. On this side, the slack is already taken up. I can't get that initial load at all. And if I use more force than I used on the left side, there's no give, okay? And if we analyze the big sacroiliac ligaments, this is the sacrotuberous on the left. And I can load and spring it a little bit. It's supposed to function that way. This one feels like bone. I cannot load it. I can't spring it. Okay. And then the other ligament is sacrospinous. And on the left side, I can load and spring it. And on the right, I'm not able to. Okay. This accompanies a pattern of rigidity on the right side, and I'm not able to spring the pelvis downward towards his foot. On this side, I can load it, and it moves to a stop point. I can spring it, it springs and it recoils. And I see that movement translate all the way down to his foot. So he's got a lack of shock absorption in the lower body, in the feet, ankles, in the hips as well. Now, he is fused, is it L2 to S1?
Correct.
Okay, so essentially the entire lumbar spine except the top segment is fused. And he did well with his fusion. He did well when he got 4-5-S1 fused. When he got the other lumbar, it didn't really help his symptoms. He then got diagnosed as having sacroiliac joint dysfunction, and that was done by a pain doctor. And he had 3 ablations. And how long did you get benefit from that?
6 months each time.
Excellent. So 6 months of relief. And your last one was a year ago?
Yeah, January of 24.
January 24. Very good. Unfortunately, it's getting harder to get an ablation. Medicare stopped paying, and the insurance industry has followed that. But I think we have enough things to work with in this body. And so I'm going to work to restore that spring mobility throughout his feet, ankles, the joint below the ankles, and the hips. And we'll come back and we'll film the response to that.